Hello, this is my policy brief project assignment focusing on the impact of alcohol use disorder. Focuses on the national facts, which are great food for thought of just how great of an impact this issue has on our nation. According to Healthy People 2030, 20 million adults and adolescents in the United States have experienced a substance use disorder in the past year alone. And according to the National Institute on Alcohol Abuse and Alcoholism, stated that 14 million adults ages 18 and up have alcohol use disorder, and 1 in 10 children live in a home with a parent who has a drinking problem. Now, taking a closer look into this matter, here are some statistics that I found focusing on our home state, Louisiana. So, Louisiana averages 1 death due to excessive alcohol use for every 2,045 people ages 18 years and older. And per the CDC, Louisiana has an estimated of 62,928 years of potential life that is lost due to the annual excessive intake of alcohol use. And the last little quote down here says that Louisiana taxpayers spend $5.132 billion or $2.58 per drink. And just let that sink in how much money that is that we are paying as a state for this. Alcohol use disorder, or AUD, is defined by the Mayo Clinic as a pattern of alcohol use that involves problems controlling your drinking, being preoccupied with alcohol, or continuing to use alcohol even when it causes problems. A person will have to intake more of the substance to obtain that buzz sensation to increase their intoxication level, because they have grown that tolerance level if you have consumed alcohol over a long period of time. And if you are experiencing withdrawals, some of the symptoms that are listed are nausea, vomiting, tremors such as like hands that are a little shaky, anxiety, or worst case scenario, you could have seizures. And when this is negatively affecting the function of your daily life, this is a sign that you or your loved one should seek support and medical help by professionals. Risk factors for developing AUD: having a bariatric surgery or multiple bariatric surgeries, underage drinking, trauma, say from childhood experiences, PTSD, intaking too much alcohol over time, and environmental influences such as family and loved ones having issues with alcohol. Mental health concerns such as depression, generalized anxiety disorder can raise the risk of developing AUD, and usually people that have experiences with alcohol use disorder will have memory loss, and they are unable to recall past events, and this is called blackouts, where they are unable to remember what happened during that period of intoxication. Consumption of alcoholic beverages should be consumed in moderation. This is 2 drinks or less for men, or 1 drink or less for women per day when alcohol is being consumed. Pregnant or lactating women should never drink alcoholic beverages because this can increase the likelihood of a fetus developing fetal alcohol syndrome or fetal alcohol spectrum disorders. Heavy or binge drinking increases the risk for developing alcohol use disorder, which is defined as 5 or more drinks for an adult male and 4 or more drinks for an adult female in about a 2-hour span, and this should be avoided. Nutritional impacts of alcohol use disorder are as follows: osteoporosis, pancreatitis, inflammation of the stomach lining, gastritis, and ulcer formation to the esophageal and stomach region. Heart disease, stroke, some cancers, hypoglycemia, anemia, liver disease that could potentially lead to cirrhosis, which is an irreversible scarring and destruction of the liver tissue, vision issues, and decreased immune response. Alcohol can interfere with nutrient absorption in the body and can thin away the lining of the small intestine due to an increased amount of acid in the stomach. Impacts continued. Nutrient deficiencies. Numerous vitamins and minerals are not absorbed in the body in the case of AUD. Minerals such as zinc, magnesium, and potassium are lost during urine excretion. A zinc deficiency can negatively affect food's intake since it can alter the ability of someone to taste and smell. Lack of B complex vitamins results in extreme fatigue, reduced appetite, depression, and cracked lips. Malnutrition. Alcohol diminishes hunger cues and then can deprive the body of key nutrients because nutrient-dense foods are not being utilized fully during digestion, absorption, and excretion, which can thus lead to malnutrition and anemia. Available resources are as follows. Nonprofits such as Alcoholics Anonymous, or AA, is a support group that holds meetings and sponsorships for members to reach sobriety goals. Rehabilitation treatment centers, as the following, are available to provide treatment for health professionals to treat this illness. Inpatient rehab centers are for prolonged treatment that can take up to weeks to a few months at a time, where a patient will live at a specific campus to receive medical treatment. Outpatient clinics do not require a person to live there in order to receive treatment, like therapy sessions and other services to help further treat their addiction. The benefits of treatment, such as cognitive behavioral therapy approach and dietetics, along with proper diet and supplementation to meet an individual's needs, thus aiding in the treatment of AUD, and provides a person the skills that are needed to thrive after treatment is over. We must appropriate funding to help establish more treatment programs with certified and licensed healthcare professionals such as registered dietitians, physicians, nurses, social workers, psychiatrists, and others. This interdisciplinary team must use clinical judgment to help those suffering from AUD. And also, more medical and health insurance companies should provide further medical nutrition therapy services to help treat this, and increasing this will help further the treatment. We can create a deterrent by providing nutrition education to bring awareness of this illness and increase the general public's knowledge about the harms that can occur in the attempt to prevent future lives from being lost.